let's proceed with the next participant, who is Basheer Marzoog. Doctor, please raise your hand and we will start.
Do you hear me?
Yeah, we can hear you. Please start.
That's great. And do you see the screen?
Yeah, all good. You can start.
Okay, thank you. Our topic for today is the frequency and severity of the PD-1 and PD-L1 immune checkpoint inhibitors adverse effects. But before I start, I want to thank my supervisor, my teacher, and doctor who always supported me and for her patience and wisdom insight during my scientific journey, without which our work would not be possible today. So, short background about the checkpoint inhibitors. These are the novel therapeutic techniques that are recently developed in the 2016, 17, 18. These new medications are approved by the FDA, and they are effective in treating, but managing, not treating the cancer, the advanced stages of cancer, but they have side effects, unfavorable side effects. These are autoimmune side effects, and our study tried to identify the frequency and the severity of these side effects. So we decided to take the data from the Mardovian Hospital Oncology Dispensary. Retrospectively, we taken 28 patients and we analyzed their data. These 28 patients, they were with various types of cancer. Of these was non-small cell lung cancer, one patient, small cell lung cancer, one patient, nodular sclerosis, Hodgkin lymphoma, one patient, classic Hodgkin lymphoma, one patient, gastric cancer, one patient, renal cancer carcinoma, and cecal carcinoma, pulmonary mucosa carcinoma, nasopharyngeal carcinoma, and laryngopharynx cancer, bladder cancer, and cervical cancer, and melanoma. These are the patients, 28 patients. Yes, the sample size is small, so there will be a bias absolutely. The setting of the study we mentioned, it was from the January 2019, the data collected from 2019 to January 2019 to November 2020. And the patients, they were followed for the same period, the January 2019, November 2020, and we recorded the adverse reaction during this period. The materials and methods, the patient prior to the immune therapy, they received the classical chemotherapy in the same doses and for the same courses. And after the ineffectiveness of managing these patients, the patients gave their consent to receive immunotherapy. And they got immunotherapy, either PD-L1 or PD-L inhibitors. These are atezolizumab and pembrolizumab or nivolumab in these mentioned doses and periods. The result of the analyzed data shown that 7.14 patients of the 28 patients develop adverse effects. They are ranged from mild to moderate, and there was anemia in one patient. Another patient, there was elevated creatinine level, which indicate damaging to the kidney. And for a full picture of this result, we can see here the number of the type of the cancer, the number of the patients in each type, and the side effects, and the used drug, which drugs is used, and the side effects. And the important thing during the study that the biases remains because the sample size is small. We cannot absolutely take that and say that the used drug is responsible for this adverse effect. And also there was no control group, so it is also a weak point of the study. But the general side effects of the used immune checkpoint inhibitor showed a moderate to mild to moderate adverse effects. And also here we can see that
Dear presenter, sorry for interrupting you. You have 1 minute to conclude your presentation. Thank
I
you.
almost finished. Thank you. The adverse effects are in PDL1 patient, it was less than in the PD1. In the PDL1, it was high severe, and in the PD1, it's moderate. The conclusion that the clinical findings supported the moderate risk of development of life-threatening adverse reactions. And that's all. Thank you for your attention.
Thank you. Thank you, Basheer. Dear panelists, could you ask your questions? Thank you.
Hello, Dr. Basheer. Can you hear me?
Yes, I can hear you, ma'am.
Yeah, one clarification regarding the adverse reactions to these immune drugs. Is it specific because they have received chemotherapy adjuvant to the immunotherapy, if I'm
Yes,
right?
yes, you're right.
So, how can you differentiate? How was there? Was it specific to
Well,
PD1 and PDL1? How
well,
can you say specific to the immune checkpoint inhibitors, the adverse effects?
well, thank you for your question. Firstly, it's a good question, and we prior to giving the immunotherapy, the patient didn't develop these side effects before the treatment, before starting the immunotherapy. And when they started the immunotherapy, and we also by clinical analysis showed no things, no pathological things before starting the immunotherapy, but after the immunotherapy, these side effects developed. And also, I mentioned that we don't have control group, which is a weak point, so we cannot compare the absolutely the result are they directly, but we showed that immunotherapy, these medications show developed adverse reactions. It was not shortly, rapidly, but after 6 to 1 year, they developed this adverse effect after several courses of immunotherapy. So we suppose that it is related to the chemotherapy, to the immunotherapy. I mean, to the immunotherapy. I hope that I answered your question.
Okay, thank you.